Face masks during the COVID-19 pandemic, a simple protection tool with many meanings. Wearing face masks was recommended as part of personal protective equipment and as a public health measure to prevent the spread of coronavirus. Disease 2019 COVID-19 pandemic. Their use, however, is deeply connected to social and cultural practices and has acquired a variety of personal and social meanings. The coronavirus disease 2019 COVID-19 pandemic is currently perceived as one of the greatest global threats, not only to public health and well-being, but also to global economic and social stability. While the first 2 decades of the third millennium were characterized by crisis, most notably the economic downturn of 2008 and the looming climate change, the spread of the severe acute respiratory syndrome coronavirus to SARS-CoV-2 virus originated from China has given rise to most drastic social and political responses. This included measures as several as states forbidding citizens from leaving their homes and effectively shutting down all social and economic activities. In Europe, Italy was the first country to officially detect the presence of COVID-19 in its territory, and it swiftly adopted measures to contain its spread 2 to 4. Within a few weeks, the epidemic progressively spread across Europe. The pandemic took lots and lots of Italians, and this really reduced the population of Italy. Some considered it just a stronger influenza. Others drew parallels with the very deadly Spanish flu outbreak in the 1918 to 1920, and many were simply not sure what to believe. Nevertheless, most felt the novel and unpleasant feeling of being vulnerable to the invisible threat of the infection. For example, to be the ones in danger, or to be the contagious themselves, for example, to be the danger. A variety of public health and hygiene measures have been initiated. The most visually noticeable, perhaps, is the wearing of face masks. The medical research on the use of masks as personal protective equipment (PPE) against SARS-CoV-2 transmission was interpreted very consciously, and the initial guidance from health officials was conflicting. The WHO advice was conceived to avoid unnecessary paternalism and at the same time to be comprehensive in discussing different medical aspects of mask wearing. However, different mandatory or voluntary practices and contradictory indications about the utility of face mask wearing were introduced across affected countries. Generally speaking, face masks have been adopted as one of the measures to reduce the COVID-19 spread across Europe and African countries, despite the fact that wearing masks in Europe is not common or familiar, and it is often associated with Asian countries. People were left to put on any protective gears as long as they covered their face, mouth, and ears. COVID-19 claimed the lives of more than 900 million people since the start of the pandemic in early 2020. May their souls rest in peace.